Hi there, my name is Tim. I do marketing here at Real Dr. Seattle. And in this video, I want to go over and talk through one of the most common objections you're going to get through in the sales process. I need to talk with my spouse. For sure, no matter which practice you're at, you're always going to encounter this. All right, so I just want to go through 3 steps. First step is during the sales process, this should be pre-loaded, all right? That is, when the patient comes in, most likely she's already been thinking about it for months or for years, discussing it with her spouse, and they're already aware that it's going to cost some amount of money. So this isn't going to be a surprise to the spouse. So when you start the process, say, hey, is there anybody else who needs to be involved in this decision? And if she says, yes, my spouse needs to be involved, then you can handle it right there. Okay, well, should we go ahead and get your spouse on the line? Should we postpone this meeting and include your spouse? Should we do it another time and do a virtual meeting with your spouse? And address that objection right there. And sometimes they'll say, yeah, I want to go ahead and reschedule and bring my spouse in. And other times they'll go ahead and say, well, you know, I can go ahead and spend up to X amount, but if it becomes a lot more, then I need to talk with my spouse beforehand. Okay, so that kind of makes sense. Now, if this objection kind of comes up late stage, you have to do a little analysis, because this can be a very convenient excuse when she has some other objection that she wants to keep hidden. And most likely it's cost. It can be like, wow, this cost a lot more than I expected, but I kind of don't want to tell you that. So I'm going to say, well, I need to check with my spouse beforehand. And so you may need to do a bit of subtle psychology to understand that. Other times it could be just because you didn't vibe very well with the prospect, or they don't believe in the skill set, all right, and they have other concerns. Or it could be just because recovery period is longer than they anticipated, and they say, geez, I can't take off that much time from work. And so they kind of want to hang it on this reason. And so you may need to do a bit of probing. If this comes up near the end, when the client says, oh, I really need to check with my spouse beforehand, there's 3 things I want you to do. The first thing I want you to do is acknowledge and understand. Say, you know what, I totally understand it. That happens with a lot of other patients where they need to check with their spouse. I get it. All right, and then you can't leave it at that. One of the clients I worked with, they left it at that and said, okay, go ahead and give us a call when you're ready. They never followed up, and they actually let 45% of the leads, hot leads, drop just because of that, because they never followed up. So after you acknowledge and understand, the next thing I want you to do is get a commitment to what the objection is. So if your spouse says it's okay, then are we going to be in a position to move forward, or is there something else I can address? And just say, hey, help me understand this, so I can serve you better, all right? And nail it down to the particular objections, which commits the prospect to continuing if those objections are cleared. And then finally, when you understand that objection, go ahead and make a very, very specific commitment or path of action to resolve that objection. So she says, well, I need to talk with my spouse first. Say, okay, great, I understand. How about if I call your spouse at 6 p.m. tonight and we'll have a conversation together? Well, oh no, my spouse doesn't get home until 6:30. That's fine. How about if I go ahead, I call at 7 o'clock, you go home with the treatment plan, you go over it beforehand, explain what's going on, we can get on Zoom meeting after 7 o'clock, we'll discuss it together, and I can answer all of his questions at that particular point in time. And be persistent on getting an action item to resolve that particular objection. Don't let it go. Then she'll go ahead and she'll make that commitment, and then you'll have the opportunity to overcome that objection. And once one is done, then the client, she's already morally obligated herself to be consistent and then follow through with your sales plan, which means you get the sale. That's what you want. Anyway, if you have any questions or you need help with your sales or marketing, go ahead, give us a reach out here at Real Dr. Seattle. You know, it's always free to give us a call and just get a quick opinion and see how we may be able to help you. Cheers.